In this video, I'm going to go over some tips that you can do if you're suffering from lateral epicondylitis, also known as tennis elbow. Now, tennis elbow or lateral epicondylitis is irritation and inflammation of this outside portion of the elbow here. Most commonly, it's the ECRB, the extensor carpi radialis brevis tendon. Because of its small attachment point, you may have pain that's on the outside of the elbow. That pain may radiate down the back side of the arm, maybe into the fingers. It can also radiate up the arm towards the shoulder. It can be very debilitating. It also can cause a lot of problems as far as being able to grip, hold on to objects, just a whole host of issues it can cause. So here's some simple techniques that you can do to try to reduce your pain, improve your strength, and restore function of your hand. The first thing we're going to do is wrist extensions. You're going to take a dumbbell, start with a light dumbbell, and I have my forearm propped up here on this foam pad. You can use a rolled up towel or just whatever just to kind of prop up your forearm. And I'm going to work on bringing my wrist back into what's called extension, so just back like this. You're going to pull that back somewhere between 2 to 3 sets of 10 to 15 repetitions. You should feel that on that outside portion here of the elbow where you're having pain. Initially, if it's too painful for you just to go back and forth, you can start off what's known as an eccentric. So you're going to take your other hand, pull the dumbbell in place, and slowly lower that down. When you get to the bottom, use your other hand again and pull that back and slowly lower that down again. And just repeat that the same way, 2 to 3 sets of 10 to 15 repetitions. Then we're going to flip the dumbbell over and go into wrist flexion. So you're just going to pull back like this. You're the opposite of that wrist extension. So you're going to pull this way. You're going to feel this on the inside portion of the elbow here. Now, even though that's not the side that you're having the pain, the irritation with, it is important to strengthen the whole area because you are still having to maintain some muscle contraction of those other muscles on the backside while you're going through that movement. And you're going to complete 2 to 3 sets of 10 to 15 repetitions. Our last dumbbell exercise is going to be pronation and supination. So you're going to grab the dumbbell at the bottom and you're going to work on turning the dumbbell down this way, back over, and back over again. So each time that I go over, that counts as 1 repetition. And I'm going to perform that for 2 to 3 sets of 10 to 15 repetitions. If that's too uncomfortable, initially you can grab the dumbbell and just hold it in the center and just kind of go back and forth like this. But as you become more confident, things start to feel a little better, hold the dumbbell down at the bottom and then repeat it the same way, 2 to 3 sets, 10 to 15 repetitions. Next, we're going to use these finger extension bands. I like these bands. These are by Alpha Grips. I'll put a link in the description. And what you're going to do is just pull the band apart like that. You're going to feel that all the way down the forearm. You can feel those muscles working down in the back side of the forearm. And repeat that for 2 to 3 sets of 10 to 15 repetitions. Now we're going to perform a rotational movement using a washcloth. So what you're going to do is take a washcloth or a hand towel and you're going to work on kind of rolling it up, almost like you're wringing it out. And you're going to kind of go forwards, 2 to 3 sets, 10 to 15 repetitions. And then you're going to go back. So you're going to go back the other way and pull it back down this way. So you're going to go forwards and then back, 2 to 3 sets, 10 to 15 repetitions each direction. Our last strengthening exercise, we're going to use one of these hand grippers. Again, I'll put a link in the description. I do like this one by Alpha Grips just because it has a counter on the bottom, so you don't really have to keep track if you don't want to as far as your repetitions. Just kind of glance down, you can see. And then also it has a dial on the end where you can adjust the resistance level that you're using. You're just going to work on just squeezing that, different positions. You can do it with a palm up or in neutral position. It doesn't really matter, but I usually have my patients complete 2 to 3 sets of 10 to 20 repetitions using a hand gripper. Another thing you can do to try to gain some relief from your pain and tension is use one of these myofascial balls. I'll put a link in the description for this. You can just use your other hand, go right over the spot that hurts, hold pressure in there, kind of knead around in that area. You can take this and go up against a door facing or a wall and hold pressure with a ball up against a wall. That works well too. And just to kind of relax the entire area. Sometimes that increasing that pressure just kind of feels good in the general area. And you repeat that just throughout the day, just as tolerated. A lot of times people will carry one of these, you may be in their bag or their work bag. You can also use a tennis ball. If this small one here is a little too intense, you can use a tennis ball and accomplish the same thing. The last thing I want to work on is stretching. So what you're going to do is you're going to bring your wrist down this position, take your other hand and pull back. You're going to feel that stretch across the top here. So you're going to hold that somewhere between 10 to 30 seconds. Repeat that for maybe 10 repetitions. This can be a little uncomfortable at the wrist as you push in. You may get a pinching sensation, so maybe don't push as far, but just really work on bending that down and stretching this entire area. Thank you so much for watching. I hope this video helps improve your tennis elbow. Make sure you hit that subscribe button so you can stay up to date on all my content.